What started out as accepting a speech at the University of Georgia's Food Safety Conference morphed into a number of great meetings that I was able to have. When the team thought about sort of what other equities do we have that are in the Atlanta area, you didn't have to go more than a couple of miles to realize the State Commissioner of Agriculture is there. The CDC is literally across the street from where the conference was held. And then our district office in Atlanta, as well as our laboratory in Atlanta. And so all of these things, they were literally within a few miles of each other. So it was a rather productive couple of days. I was invited to speak at the University of Georgia's annual Food Safety Conference in Atlanta last week, which I was very excited to be able to do. And it gave me a chance to talk to many people in the food safety space, from industry, from academia, from the public interest community, about what our priorities are here at FDA and the Human Foods Program. So I was able to give our messages around microbiological chemical safety, about food chemical safety, and also nutrition as a priority. For the Human Foods Program, I think artificial intelligence is and will become more important in the future. With limited resources, we have to use information to help us figure out where we want to target our efforts, in particular as it relates to inspectional work. To do that, we're trying to use information and machine learning, artificial intelligence, to target our inspectional activities. I think that we want to deploy these kinds of techniques across our inspectional work. When you are not resourced to get to as many facilities as you would like to, it's really important to use information to be smarter about where you want to deploy those resources. And I think artificial intelligence is going to play a very big role going forward in this program. One of the reasons it's so important to have strong partnerships with other federal and state agencies that are doing work that's related to what we're doing is for when there are emergencies. And so you're not trying to develop the relationship in the middle of emergency, which is very hard to do, but you're relying on a partnership that you've already built. It was clear to me that at the operational level, it is a really strong partnership. I met with a group of scientists at CDC who were doing collaboration with on cyclospora and the people that we're working with on PFAS. So across our program, there are collaborations that the Human Foods Program has with the CDC. So it's a really important relationship. We also do a lot of work with the CDC's nutrition group, which I was not aware of until I was getting ready for this trip. And again, our teams are pretty seamlessly working together. Our priorities on nutrition are their priorities. Yeah, I had a great meeting with Commissioner Harper from the state of Georgia. You know, our state partners are critically important to our ability to deliver on food safety in this country. They do a lot of the inspections that are actually on farm, FSMA inspections on farm. It was a great meeting. In many ways, it was just about relationship building. It is good to have some connection with your partners, and so I wanted to build that connection with Commissioner Harper. They were very complimentary of their work with the FDA. We were very complimentary of their work. You know, we have some challenges. We have some budget challenges, and we were very frank about that. But I think that's the way in a good partnership you deal with challenges. You get your issues on the table and you start talking through them, and hopefully you can bring them to a good solution. But it was a very good meeting. I was pleased to have an opportunity to talk with him. There's an ORA district office as well as an ORA laboratory. It was the first lab that I had visited that is doing nutrient content testing. They have samples of food taken off the shelf of a grocery store, and they're testing to see that the food has in it what their nutrient fact label says. Because we want to make sure that a product claims to have a certain amount of protein, it has a certain amount of protein, because we're hoping consumers are making choices based on this information. So that was really interesting. They also are doing infant formula testing, as we all know, is critically important as we work to ensure that infant formula meets the safety requirements that we have of them. And then I spent some time with the district office staff in ORA, and we had a town hall meeting. Some really great questions from the staff. It was very well attended. We had a full room. Always great to get out and meet with FDA personnel. A lot of energy, a lot of excitement. You could see the work being done there and its relevance to what we are trying to do in the human foods programs.